Hello everyone, I'm Dr. RMD, Pediatric Resident at PGI Dr. RML Hospital, New Delhi. So, in the last 4 to 5 months, we had a series of NEET PG 2024 videos where we had discussed strategies, revision strategies, and now NEET PG 2024 has come to an end. So, we are going ahead with NEET PG 2025 series, and this is the first video of this series. An important point to be noted before I start this video, my frank suggestion. By the time when I'm recording this video, there is a lot of violence that is happening against doctors. There is an attack on RG Khan Medical College where the goons had vandalized the hospital premises. So my sincere advice to you before going to NEET PG, because it's not too late, change your profession. Either consider pursuing medical career abroad or change your medical profession, because it's not entirely out of scenario now, because you have done your MBBS and you have not done your post-graduation yet. It is not worth becoming a doctor in India. So for those people who can't change their career and they are going to continue with their future medical career in India and NEET PG as a bridge to it, so for them we'll be continuing ahead with this video. So in my YouTube community post, I had also told before starting this series, you should watch this video, because this video will form the base for all the things that we are going to discuss today. So this video was watched by more than 1.3 lakh students in last 4 months. So this video will exactly tell you how NEET PG has changed over last 4 years and how we need to focus selectively on those topics and how those subjects are going to gain more advantage, gain more importance in the coming future. So watch this video if you haven't watched. It is the link is given in my video description and also in the comment section. These were other videos that I had released in the last 3 months, and one of these videos had gained more than 1 lakh views, some of them 47,000, 62,000 views, and then I got comments regarding these videos. The feedback that I got is that these videos were really helpful in their preparation. So these are few comments that I got in my chat section, that is after NEET 2024 exams had been done, and most of them had told that my videos had helped them a lot. Even though this time the paper was out of prediction, still the revision strategies that I gave and the content that I provided, like what to study, how to study, which are the important topics, how to frame your timetable, all this had helped them a lot. So that's why if you haven't gone through, if you have been a follower of my videos since long time, you will be knowing how my content is. If you are not, then in this video we'll be discussing those in detail. So now NEET PG 2024 has ended. So on the date of Independence Day, when I am shooting this video, NEET PG 2024 is over. Now what next? Do you want to attempt NEET PG 2025? Or this video also holds true for those interns and post-interns who are currently preparing for NEET PG 2025. So what next? So what are the problems that are faced by students when they are preparing for NEET PG 2025? So right now there is only talk about NEET PG 2024 and no one is talking about NEET PG 2025. So I happen to be one of the foremost YouTube mentors who is commenting right now on NEET PG 2025. So we'll see what are the problems that students are facing, since we have around 8 months left, because we'll assume that NEET PG will happen somewhere in April. So that gives us around 7 to 8 months for our preparation. So based on that, we'll see what are the problems that each student faces. One is students don't know how to start, where to start. Okay, we'll be addressing all these problems in this video. Then second, content is so much, so they don't know how to finish entire content in 4 or 5 months. That is the problem. Okay, next, what is important and what to focus on? This is the most important part during your preparation in this last 8 months. Then what is a timeline? How to prepare, when to revise, all the timeline. Okay, then many of them who are attempting NEET PG 2025 are in their internship. So how to manage internship duties? What is the ideal study plan? Because I tell you everything and then you don't come up with an idea, you don't come up with a plan, what is suitable for you. So I have given an example for that also, how to go ahead with your study plan and how can I personally help you. That also I have discussed at the end of the video. So don't skip this video. This is going to be a lengthy video. So be there till the end, because whatever I discuss, whatever each and every small point that I discuss, every small detail will carry huge significance later on, because this is going to be a turning point. Now coming to the first problem, that is how to start. What happens is during your preparation, now you will be halfway during your internship, or maybe your post-intern, and you are going to start your preparation now, or maybe you had studied earlier few topics, maybe you had covered few subjects earlier, and now you want to cover everything in this last 7 to 8 months. So first thing that will happen is you will become blank. You will have no planning because you don't know where to start exactly. So even though you start, like for example, you decide to start pharmacology, you start with pharmacology, but you take 10 days for one subject, and then you will be like, I have not reached anywhere near this subject. Like the content is so huge, you will lost the track. Okay, so my job in this is to guide you along this path. Okay, you are passing through a jungle, you don't know the path, you don't know where to go through. So my job is to make sure that you go through the right path. Okay, so there are two scenarios when you go through anything right now. Okay, so first is like you start studying and then you realize the content is so much, you have not done well in your MBBS days, or you have forgotten whatever you have studied, so you go into depression and you stop studying. You think you will give one more year break. Okay, second, you give a GT and then you see low scores and then you think, okay, I'm going to stop now, I can't do much now, so you are going to stop. Okay, so if you take a break at this time, even if you're internship or even if you're post-intern, and you decide that you will start from very beginning next year, and then you will give everything what you can for your NEET PG 2026, then that is going to be wrong. Because at this point, if you have a turning point, if you choose to not give up right now, because right now you have 7 to 8 months. Remember, in my last NEET PG 2024, when it was 3 to 4 months left, I had started just when it was 3 to 4 months left, but still people managed to get a good score in NEET PG. Okay, like they have confidence right now. They are commenting me, they are telling me in my chat box, they are telling me in my email that my videos actually help them to start. Okay, this is going to be your changing point. Okay, this is going to be a turning point. So don't give up now, because 7 to 8 months is a big time to change yourself. You can actually change things a lot in 7 to 8 months. Okay, so right now is not the point to take a break. Right now is the point to change your career. So where to start? Number one thing is grand test, and I say this because I have experience. In the last 4 to 5 months, I have talked to more than 500 people who are in their ripe of their preparation. Okay, who didn't know what to do, who had many doubts in this, and then you will see what are their comments. See this. So you notice that most of them had not started giving a grand test. So that was their main problem, and that was the thing that they used to tell me, because I used to have this one-to-one person on-call strategy. So during this time, people used to tell me that they had not started giving GT, and that was the main problem. That was the crux of it, and they realized it later on during their preparation when it was too late. So my first advice, which is never to be ignored, is start with a GT. Grand test forms a base for everything. Grand test forms a foundation. From grand test, everything changes. Because once you give grand test, you know where you stand, what is your foundation. No matter about your preparation, no matter how you are prepared, no matter, even if you are not finished 2-3 subjects also, even if you are not started also, still you have completed 4 years of your MBBS. That means you can still give a grand test. You have that basic knowledge. So grand test will be that initial point. It will be the turning point for your preparation. So first give a grand test. So always start with a grand test, and then you will know automatically where to improve. I'll tell you how. How frequently should give grand test? This is one more question. That is, right now you should give every alternate fortnightly. That is, every 2 weeks you will have to give a grand test, and after every grand test you will have to review. How to review, what to review, how to improve after every grand test, I'll tell you. One of the most important thing that will change your preparation is when you ask after every GT, how can I improve? How can I improve after every GT? Okay, after GT, how can you improve? That is a question that I asked myself in my last 6 months of preparation. That is how my preparation actually changed. I'll show you how. See, my preparation started seriously when I started giving GT was in the month of November, when I was preparing for NEET PG 2022. In the month of November 2021 was when I started seriously, and that time I gave a test that was INI mock, and I had scored only 98 score out of 200. Okay, I had done only 98 correct. So that was my turning point, because when I gave that test seriously, I realized that if I do 98 correct, I am not going to stand anywhere. Okay, so I had just 6 months left for my NEET PG. So then I started making this, and then realized which are my weak subjects. So my main aim was to selectively build on these weak subjects. So I made this Excel sheet, and where I gave percentage to each subjects, and so that I could monitor my responses later on. So after that, I gave my GTs and NEET mock and other GTs. Okay, so based on these, you can see that how my individual subjects are changing, because I know where to improve, how to improve. Okay, so this was my journey, which I have explained in detail in this video. You go to this video, NEET PG 2024, improve your GT ranks in 3 months. In this video, I have clearly mentioned how to improve your GT scores, how to review, when to review, what to review. Everything has been mentioned in that. Okay, so I just don't want to make this video more lengthy, so I just go I have provided the link in the video description, also in the comment section. So just go through this video. And this was one screenshot of one of the NEET aspirant who was preparing for NEET 2024 last time, and he sent me this video after being motivated from this video. So he sent me this screenshot where you can also see how his subjects are improved. Initially he had so many weak subjects, okay, and then later on he reduced the subjects to 2 or 3 subjects. So this is how you change. Okay, so this is the first thing, that improvement. Okay, what can you do to improve your GT score? That question itself is going to improve your rank. Okay, moving on to the next problem. Second problem is content. This is a very major lapse in today's coaching institute era, because coaching institutes will give you every information, every sort of information. That is because of strike rate. So every coaching app is judged according to the strike rate. That is how many questions they had in their app or in their classes which they could teach you before NEET PG. Like for example, in NEET PG 2023, almost every coaching app had strike rate of more than 90%, which means that more than 180 out of 200 questions had come from their coaching app. But this information is spread. Okay, this is a major concern, because when you have limited time like 8 months, you can't go through everything. Even if you go through everything in like 2 years or maybe 1.5 years, you are not able to remember everything at the end of the day. So what is this information? See, if these questions are asked for NEET PG, okay, so coaching apps will include everything under this heading. They either main videos or notes, either QBank, custom modules, PYQs, pearls and revision videos and notes. So all content is included in that, but you should be smart enough to select what is important for you. So be very attentive in the next few minutes on what I'm going to tell you. Okay, see, these are the questions that are asked for NEET PG. Okay, this circle that you see, these are the questions that are asked for NEET PG. Now, what do main videos and QBank tell you? See, these are the main videos content. Okay, so main videos will cover almost 90% that is required for NEET PG. Second, QBank also constitutes 90% that is required for NEET PG. You will notice that some points of main videos are not covered in QBank, some points of QBank are not covered in main videos, and combined of main videos and QBank, some around 10% is not covered under NEET PG question. That means that 10% of the questions even no coaching app can predict. Okay, around 15 to 20 questions no one can predict, not even coaching apps. That's why their strike rate is always 90% but not 100%. Got my point? Okay. Now, very important thing is, now you might tell that I'll read main videos plus I'll read QBank. But the problem with this, do you notice the magnitude of this circle? NEET PG circle is smaller, but this main video circle is so huge. It is almost twice or thrice of NEET PG circle. And also QBank circle is also so huge. So that means this needs lot of time. It needs lot of memory power. It needs lot of efforts, which you don't have right now. So what you should do, you should go for smart things. We'll go to the next graph. See this analysis. These are the NEET PG questions, and you'll see this PYQs. Why have star bookmark PYQs is, star mark PYQs is, see, it is a smaller circle. Compared this to with pearls or treasures. Pearls or treasures is a very large circle, which means information is huge. Content that comes for NEET PG is almost the same as NEET PG PYQs. So PYQs and PYTs are the easiest method to guess what comes in the future exams. This is not my experience. I'll tell you in the next few slides, like how this is how I have statistically proved it. Okay, how PYQs are the sure shot. Okay, so if there is anything that will give you 100% reliability, that something that is asked for the exam, you can study well in advance, that is PYQs. So never ignore PYQs. PYQs are the easiest means of getting answers correct. That told, also look at this graph. This is very important. PYQs don't cover everything that is asked for NEET PG. Got my point? What covers everything asked in NEET PG? That also I'll tell you. Okay, so also you'll see that some of them will tell I'll go through pearls or treasure. Okay, you are very good, you can go ahead, but then again it will not cover everything. Got my point? Next, what about GTs? So this is the graph for GTs. Okay, this is the analysis diagram. See, suppose you have solved one GT, it may not have any questions from NEET PG. Suppose one more GT, GT2, it will have some questions. Okay, GT3 will have some more questions, GT4 will have some more questions. If you solve maybe some around 10 GT, then you will have some, like, you will be covering around like 30 to 40% of NEET PG questions. Okay, but there will be some GTs like recall GTs which will have majority of questions asked from NEET PG. So the more number of GTs you give, the more chances is that your NEET PG exam is going to go well, because you will be exposed to such type of questions. See, what is your main aim? Your main aim is not to prepare everything from coaching app. Your main aim is to prepare for those questions which are more likely to be asked in the NEET PG exam. So next, what about NEET PG and revision video? This is the question which I got very frequently during my NEET PG 2024 series. And why I have described this in dotted line, that is because revision videos only matter when your concepts are strong. If your concepts are strong, then you should go to revision videos, because right now you have time. When I was shooting videos for NEET PG 2024, when I was shooting hear this carefully, when I was shooting videos for NEET PG 2024, you had no time left. There were only 3 to 4 months, and that time revision videos was the mainstay. It was the first line of preparation. But right now you have 7 to 8 months of preparation. So right now revision videos doesn't matter much. I'll tell you in the further part of the video how to detailedly prepare. Okay, how to prepare in the 7 to 8 months. But right now revision videos is not a good choice, because if your concepts are not strong, you won't be able to answer. Like all this doesn't guarantee you that NEET PG questions you will be able to answer them. Okay, if your concepts are strong, if your memory is strong, only then you will be able to answer this. So revision videos are like 50-50. So how to know which questions will be asked in NEET PG? This was a question that I always asked myself. Okay, how to predict, like how to know whether questions will come or not. So what I did, I went back. I went to history. So I went through NEET PG 2023 strike rate of all apps, and in that I have taken, just for an example, I have taken Marrow, because Marrow had published this in their newsletter also. It is also available on their website, which is free to all, and it is also available on their Facebook page. It is also available with other apps also. So every app for NEET PG 2023 had given strike rate of more than 90%, or some apps even had gone up to 96%. So Marrow had given 189 out of 200 questions were already in their app. I repeat this, 189 out of 200 questions were already in the Marrow app before NEET PG 2023. And as a proof of that, they had given a series of screenshots in their Facebook page, which is also available for free. So I went back and checked them. Really, are they available? So when I went to this, I categorized this in a different set, okay, because I like to do statistics and to see if there is any significant variable that is available. So what I did was, I selected 40 questions because I didn't have time to go through all 200 questions. So as a sample size, I selected 40 questions. So I went through 40 questions which are provided by Marrow Facebook page, and then I went through those MCQ IDs, and I divided questions into 3 categories, okay. One was the normal questions, which are one was previous year questions, okay, either recent NEET or AIMS. That was one category, that was PYQs. So I wanted to know how many PYQs that were provided in Marrow app with tagline of PYQs, tagline recent NEET and AIMS, were actually present in the NEET PG Marrow app, okay, Marrow app before the exam. Then second category was how many questions which were not PYQs but were answered by more than 50% of the students right, okay. And third was how many were answered by less than 50% right, okay. So what I did was, I saw that there were 10 questions which were PYQs. Out of 40 questions, 10 were PYQs. So you can imagine, out of 200 questions, there will be 50 PYQs. 50 PYQs out of 200 questions. Okay, this is just I'm multiplying it, okay. So there may be increase or decrease, but you take it as this one, like PYTs and PYQs almost carries 50 questions. What was surprising is, I categorized this as 2 groups. I included PYQs under more than 50% right, because anyways any PYQs more than 50% of students will get it right only, okay. So when I calculated that, 5 questions, there were only 5 out of 40 questions that were asked in NEET PG 2023 that were answered by less than 50% of the students right in Marrow app, and there were 35 questions including PYQs, which were answered by more than 50% right. So you know that in Marrow app or maybe in any app, in coaching app, you will note that how many percentage of people have answered that question rightly. Okay, there is an indicator for that. Okay, so when I looked at that, I found that 35% people had answered more than 50% questions correctly. 35 questions, okay, not than 35 people. 35 questions out of 40 were under the category where more than 50% of people had answered it correctly. So I took the probability of this, and according to this, 165 questions out of 200 were those questions which were answered by more than 50% of the people right. Then when I took the probability that any question randomly picked from NEET PG question paper, okay, any question, I repeat again, any random question that is picked up from NEET PG question paper, not grand test or anything, NEET PG question paper has 82% chance or 0.82% probability that it was answered by more than 50% students right in Marrow app QBank. Got my point? So 8 out of 10 questions are those which are answered more than 50% of the students correctly. Now I had to know what is the significance of this. Because this became the case, I had to do something with control. Now for control, initially I thought I'll go to the QBank, so I went to a random module. I picked a random module, okay, because there shouldn't be any bias, so I picked a random module on Corynebacterium, diphtheria and listeria. So Corynebacterium, diphtheria and listeria, when I went through that, I knew that it would be biased, because when 4 options are given, when Clostridium is there or maybe Corynebacterium is there, so that means that definitely will be selecting that option only. So that is biased, so I can't take that. So I didn't take from QBank. So next I went to custom models. I took 40 questions from custom models and I started solving them to see if there is any bias. And I realized there is also one bias in custom model, that when you don't select difficulty, it will give you medium difficulty only. And medium difficulty, almost everyone answers 50% questions right. So I had to select something random, which was at that point of year only. So I went for a random GT, which was released at the time NEET PG 2023 recall was released, and I went through the first 40 questions of that GT, and then I made this graph again, and I realized that. So I could equate this random GT, okay, I could equate this to a random QBank. When you solve any random question, okay, what's the probability that the question that you get is answered by less than 50% correct, and what's the probability that is answered by more than 50% correct, okay? So I realized that the ratio is around 50 by 50. So that means when you're solving any QBank in Marrow or any other app, or when you're solving any other question source, there is 50% chance that, okay, there is 50% chance that the question that you get, okay, that the question that you are solving is answered by more than 50% of the students correctly. But in NEET PG exam, there is 80% chance that more than 50% students answered questions that correctly, that questions are going to come. That means that, okay, see this. That means that more than 50% answered correctly questions, the chance is 62%, because I have subtracted PYQs from that, okay, 62%, but less than 50% answered correctly questions is only 18%. So only if you go through questions in a QBank, for example, maybe there are 20 questions. That means out of that, 10 questions are the ones which has 18% probability only of coming in NEET PG exam. But rest 50% of the questions have 82%, or if we exclude the PYQs, there is 62% chance that they'll occur in NEET PG question paper. Are you there with me till now? Okay. So what is the take home message from this? This is a very important analysis, because you will save your 50% of your time. You will save 50% of time and 50% content if you solve QBank smartly. And by the mean, how to solve QBank smartly? Suppose you have QBank of 20 questions, okay? And in these 20 questions, if suppose you take 1 minute for each question, so you are using 20 minutes for this QBank, okay? 20 minutes for 20 questions, that is 1 minute is equal to 1 question. If you go through only those questions which are answered by more than 50% students correctly, then you need only 10 minutes time, correct? So you will be saving 50% of your time, and in the rest 50% you can solve one more QBank module. This is how you do smart work. I had to give statistic just to prove that. Because if I give a random thing and I tell you that, like many YouTube mentors will tell you that go through QBank, go through important questions. What is important question? The first thing that I ask everyone, what is important question? For a normal student who is just going to start your preparation, how does a student know what is important? What is important, what is not important, which is most likely going to be asked? So see this thing, see this statistics, okay? NEET PG 2023 question paper proves that there is 82% chance, 82% probability that a question which is answered by more than 50% students correctly has 82% chance of getting asked in NEET PG exam. As simple as that. And when you're solving any random Q bank, there is only 50% chance that you will get such questions. So that's why collectively focus on questions which are answered by more than 50% of the students correctly, even in your GTs. This is very important, because when you review your GT, okay, your first point that you notice when you review your GT, how many students have answered it correctly. If it is answered by more than 50% of the students correctly, and if it is a PYQ, definitely you have to go through the explanation. Because when I was going through this Marrow NEET PG 2020 strike rate analysis, I noticed that all the questions, everything what is there is in the explanation part of the questions. It is not in the question per se, it is in the explanation part of the question. And these explanations, like you can't go through all 200 questions when you're reviewing a GT, but at least go through those questions which are more than 50% answered correctly. Because if suppose you have got a GT where there are 200 questions, and you when you see how many more than 50% questions are, you will get around 100 to 120 questions only, and these 100 to 120 questions have highest probability of getting to be repeated in NEET PG. Got my point? So PYQ's 25% chances there to occur in NEET PG, but I told you in that graph also how PYQ circle is the smallest circle and it has highest probability of getting asked. So always PYQs first, then goes your more than 50% of the questions which are answered correctly by the students, and last, if you have time only, then only go through this less than 50% of the correctly answered questions. Got my point? So third thing is what is important and what to focus on. Okay, which subject to focus on, which topics to focus on, because I told you how to focus on the questions. Okay, because right now when you have time, Q banks carries a very important role. Okay, and I'll tell you in the later part of the video, in the ideal study plan, how to properly target Q bank for which subject, which topics, what you have to study, which for Q bank, which for PYQs, everything I have told you in the last part of this video. So third problem is what is important and what to focus on, which subjects to focus on. I have discussed detailedly in this video, detailedly. Okay, so if you haven't watched, please go back and watch which subjects are important. The top 10 subjects, the top 10 high yielding subjects I have discussed in this. So this was also a video from previously, and then you can see how the statistics have changed over the last year. I have provided detailed graphical representation of everything. So we will not go into the depth, and you will see how this old NEET PG pattern between 2018 and 2020 and new NEET PG pattern that is after 2020 has changed, and how this peak you will see in this clinical subject, how it has changed. Okay. So the conclusion that we obtained from this video was that you should be clinical, you should have clinical mastery of this subject. And in NEET PG 2024 also same thing happened. Surgery, OBG, ENT, Ophthal, all this biochem, FMT, Ophthal, all this had high weightage, including pediatrics. I have not mentioned in this. I had mentioned in the later part of the video how these clinical subjects are gaining more importance. I had discussed detailedly. Okay. So for a normal student, in this video I can tell you this much, which is important. Okay, for a daily basis, P4, S4, BF formula. Okay, these 10 subjects: pediatrics, psychiatry, pharmac, patho, surgery, OBG, ortho, skin, biochemistry and pharmac. These 10 subjects are the top scoring subjects. Secondly, grand test. You should not leave grand test. Okay, grand test is a must. Thirdly, PYQs, everything PYQs. Okay, because now you have time. Last time when my NEET PG 2024 series was released, I told you specifically to go to NEET PG because you didn't have much time. But right now you have time. You have to go to NEET, AIMS and FMG also, because this time in NEET PG you have seen that how INICT questions were very important. So go through all these 3 questions, and Q bank focus on more than 50% correctly answered question. I'll give you a detailed study plan at the end of this video. So what is a long-term plan? Whenever you are going through any GT, or whenever you are going through any Q bank, or whenever you are going through any notes, first thing is bookmark important things. And what is important, I have told you, whatever is PYQ, whatever is answered by more than 50% students correctly and it gets repeated in GTs, these 3 things should be bookmarked. Some random thing which is not at all asked any time, which you are supposed to memorize, don't bookmark it. There is no point. DNA replication enzymes, very important thing. You are not going to remember it. It is memorization topic. You have to bookmark. But random some shit, which how many percentage of TB patients were diagnosed as something, random thing which is asked only once, maybe not at all repeated again, no need to bookmark. Also bookmark during your GT. This is very important. At the end, like I'll tell you the timeline and how you have to use all this. So this is for long term. Okay. So keep this at the back of your mind. Next, Fourth problem always is regarding timeline. There is a lot of uncertainty. When will NEET happen? Whether it will happen? Whether there is next? Okay. So right now we'll assume that NEET happens in somewhere after March. Okay, somewhere after March. So our main target from today, August 15th, is you have total of 7 months. Okay, and in these 7 months till March 15, your preparation should be done. After that, whatever extra time you get will be your bonus. Okay, so from August 15 to December 15, you will have 4 months. This is for the preparation phase. So during this phase, you will be going through first time or revision preparation, whatever it is. In these 4 months, you will have to cover all the 19 subjects. I'll tell you how. Next 2 months, you will be going to revision phase, that is first revision phase, and then here you will be going to second revision phase. Okay, this is your broad timeline for now. How to follow this, I'll tell you. Fifth problem is problem during internship. This is specifically for interns, like your working hours are not defined, your random shifts will be there, okay, and there will be uncertainty about dates or exam pattern. You don't know what to study during internship, and you need a separate schedule also during internship. So for this, I'll make a separate video. This is out of scope to discuss all these things now. So we'll discuss a separate video for you, okay, for preparation during internship. In the coming days, I'll be releasing this video, okay. For right now, you go ahead with the strategy that I'm going to discuss, okay. See, what should be your ideal study plan? This is the most important part of this video. Just hear it properly. What should be your ideal study plan for this 4 months, okay? In this 4 months, you have total of 120 days, okay? In this 120 days, 60 days will be for this 10 game-changing subjects which I have discussed. That is, this will be in subject combination. Pediatrics plus biochemistry, surgery plus ortho, pharma plus psychiatry, patho, dermat, OBG, forensic. So each will have 12 days each, okay? So each will have 12 days each. And in each of these days, divide according to your convenience. But in these 12 days, you have to finish the topic. That is the main part. If you have not finished the topic, done. You don't have to go through that again. You will be going through that in revision phase only. Got my point? The next 48 days is for this subject combination. The rest less important 9 subjects. Now, extra 12 days which are there. So here you will be having 12 days for each subject again. Okay, each subject combination. So extra 12 days that you have, that will be for GTs. Reviewing GTs and everything. So plan till December 15th is clear now. Okay, so there is no whining that you don't know the timing, you don't know the exam pattern, you don't know where to start, you don't know what to study. I have covered everything that is possible in this video. So how to proceed now? I have told you study plan. Now how to, like for example, you are going to prepare for biochemistry plus pediatrics. That is the first combination. Okay. Now for biochemistry plus pediatrics, you want to study start with biochemistry. So you don't know how to start with biochemistry. Now you don't know what is important. You don't know whether you have to start with videos. You don't know whether you have to start with notes. You don't know whether you have to start with QBank. There are so much content available for biochemistry. You don't know what to start with. So how do you proceed? First thing is, whichever subject you're going to start, watch this video. This video has 3 parts. NEET PG, what to study, what is important. Okay, this has 3 parts, part 1, part 2, part 3. In part 1, there is the discussion of biochemistry plus pediatrics. In part 2, the top 10 subjects. In part 3, the rest of the 9 subjects. Okay, in this video that was made actually for NEET PG 2024, but there I have discussed everything that is important from NEET PG point of view. So go according to that. For example, in biochemistry, in this video, I have told you like how to study biochemistry. In this, I have told you like vitamins carries the most importance, then carbohydrates, lipids, proteins, enzymes, genetics, and then the clinical part. So that means if you have 12 days for chemistry, biochemistry, then you will be giving 2 days each for each of these topics. And you have to go in this order because no matter, you don't know what will happen tomorrow, you don't know what will happen day after tomorrow. But if you leave important topic, that is going to be a crime. So vitamins and minerals should be carried on first, should be learned first, then carbohydrate metabolism, then lipid metabolism. Why this order? How I came at this order? I have discussed in that previous video. Okay, I have discussed in this video only how to go to that. Okay, so part 1, part 2, part 3, 3 videos are there. You will be going through these videos. I have given everything in detail. Okay, it was not just my experience, it was based on statistics. So once you have done this, then when you are going through each topic, like for example, carbohydrate metabolism. Okay, so how do you go? So these are the 2 algorithm. Take screenshot of this. I will be also uploading this in my Instagram page. Okay, so first algorithm is when time is available. When time is available, first you go to the subject, you segregate the topics. For example, biochemistry. You have segregated the topics according to order. You know that vitamins is more important, then you have to go to carbohydrate, then you have to go to lipids. So you have divided like this. Most important to least important. Now, suppose you want to study about carbohydrate metabolism. So in carbohydrate metabolism, the first thing that you are asked is the topic concept based? is carbohydrate metabolism a concept based topic? You know that it is a concept based topic. Yes, because it carries a lot of flow chart. Without that you won't be able to answer questions. So yes, it is a concept based. So is your concept strong? This is the second question that you have to ask. If your concept is strong, then you don't have to do much because your concept is already strong. Then you have to go to solve the previous year questions first, then go to the Q bank and focus more than 50% of the questions that are answered correctly. Focus on that and finish off that topic. Got my point? Second, if your concept is not strong, then you have to watch the video. Okay. Next, if your concept, if it is not a concept based video, suppose we take example like in pediatrics development. Okay, developmental milestones is a memorization based topic. It is not a concept based. So that time you have to go see whether it is a memorization topic. Yes. So have you read it before? If you have read it before, then fine, you will be remembering it. Just revise it through your notes and then solve Q bank and PYQs of that topics. Okay, Q bank, that also more than 50% of the questions that are answered correctly, only those questions. If not, then you have to go and read the notes. You have to get thorough with the notes, try to memorize things, and then if time is available, then you solve PYQs. This is when time is available. What if time is not available? Suppose you are planning to do some topic in 2 days and now you have to do it within half day. So time is not available. So first go to that subject, solve PYQs of that subject. So for example, let's say when you're doing subject like microbiology, okay, you don't have time, so first you will go to the PYQs. Okay, solve all PYQs because PYQs has the highest probability of getting asked in exams. Then you make a priority list of topics. In microbiology, I have told how various topics are important. Okay, so most important topics, like most important 3 to 4 topics, you have to dedicate 70% of your time. Least important, the bottom most, it will get only 30% of time. So for example, if you have 5 days left, you will be giving 3 days for most important topics and 2 days for least important topics. Now, for most important topics, you have to ask whether your knowledge is good on this topic. Whether are you thorough with that topic? If yes, have you read it before? Okay, if you have read it before, then just revise those main video notes. Don't go to the main videos, nothing, just read that main video notes. If your knowledge is good in that topic, but you haven't read that topic, okay, maybe your MBBS knowledge is good on that topic, maybe like forensic toxicology was a strong part, but you haven't read it after that, then you have to read the revision video notes of the revision videos. Okay, so what if the knowledge in the topic which is high yielding is not good? Then you have to watch revision videos because time is not much. So for example, maybe a biostatistics is not good, then you have to watch revision videos. But if you feel that your revision videos is not clearing your concept, then you can back up with main videos if needed. Okay, so what about least important topics? Just go through the pearls of those topics, specific topics, okay, and then go through the custom modules with tag of clinical or images. Anyways, PYQs you have solved here, so the major chunk is done. Rest of the things will get covered in pearls and custom modules. So this will be the algorithm that you follow. See, I have discussed everything in detail, clearing all your queries, how to proceed with each minute detail. I don't think anyone would have given this detail so far, and this is applicable not only to those who are using Marrow, this is applicable to those who are using any coaching app. Okay, for no matter which coaching app you are using, no matter what your preparation is, this applies to everyone. I have given a generalized algorithm. Okay, so how can I personally help you? That was the question. Okay, so before this, for NEET PG 2024, I had arranged on-call strategy discussion. That is, you could talk to me on-call basis, one-to-one discussion, and I would guide you. But since there are more people connecting on this, and I can't find that much time to connect to everyone, and there is always limitation of time, so I have decided that I am going to convert this on-call strategy to YouTube live sessions. So there will be in every month there will be 2 live sessions, and these live sessions will be only for those who are subscribed to my channel and joined the membership in YouTube. Under my YouTube profile, you will find an icon known as join. Okay, if you press that join button, then you can be a member of my YouTube channel. When you are a member, this YouTube live sessions will be only available to those members. In that membership videos, okay, in those member only videos, I'll be like going through the comments, and I will be individually discussing what you can do with respect. Okay, this is to so that I can address this to a large gathering rather than a few people on call, because the number of suggestions that I get, the number of of requests that I get to discuss strategies is growing on, and I can't keep up with the demand. Hence I have come up with the decision that I'll be converting this YouTube membership on call discussion to YouTube live discussion. Okay, so on YouTube live, my videos will be I will be live on YouTube once in every 2 months, twice in a month. Okay, and there I will be discussing with you like what should be your strategy on individual basis. Okay, and secondly, I have opened my new Instagram official account. Okay, Dr. RMD official. Okay, so here I will be posting all the updates that are necessary, whatever statistical results that I've got, all PDF files, all algorithms, whatever is available with me, I'll be sharing in this. And I also plan to open a Telegram channel which I'll be opening soon, so that I can share all these things. Okay, so follow my Instagram channel for every update, and you can also go to that for the recent content also. Okay, so this is the first video of NEET PG 2025 series. I know this is a lengthy video, but you have time. You have time of 7 to 8 months. This is the turning point of your life. If you don't plan at this moment, you are not going to plan for the rest of your 7 to 8 months. So start your preparation now. Maybe you are intern, or maybe you are post-intern, or maybe you have not performed well in your NEET PG 2024. You don't have to lose hope. Strategic planning is bringing the future into present. Okay, so whatever can happen in the future, I have discussed all strategic plan that can be done. Okay, so that you can do something about it now. So first thing is efforts, second thing is guidance. These two are the things that matters. See, I told you, you are in a jungle, you have to find a path on your own. Okay, I can just guide you. Okay, but if you're left without guidance, you will be roaming around in jungle without any path. So my part is guidance, which I'm giving you. Your part is efforts, which I need to see. After my NEET PG 2024 videos, I had received a lot of appreciation and gratitude from my students, from my juniors, from my friends also, that they could perform well. So I'm very happy for them. Okay, and I'm also, that's why I'm continuing this ahead. So in the upcoming videos, you'll see that I'll be helping you more in this regard. Okay, so stay tuned. Okay, follow all this, and all the best till then.